Ever pondered why understanding the heart's anatomy holds such crucial importance? The heart, with its intricate network of chambers, valves, and vessels, is much more than just a biological pump. For medical students, comprehensive knowledge of this complex organ is paramount. It aids in diagnosing and treating heart-related ailments, provides insights into the heart's functionality, and underscores the impact of lifestyle choices on heart health. So, ready to explore this fascinating organ? Now let's delve deep into the heart itself via a heart dissection. Before diving into the dissection, preparation is the first step. To begin, gather all necessary materials, which include a dissecting tray, scalpel, forceps, and of course, the heart specimen. All these tools play a crucial role in ensuring a successful dissection. Now, safety is paramount. Always wear gloves and eye protection. Handle sharp instruments with utmost care and always point them away from you and others. Now let's examine the heart externally. Identify the ventral and dorsal sides. The ventral side is smooth and somewhat flat, while the dorsal side is more rounded. Position the heart with the ventral side up. This is the ideal positioning for dissection. With everything in place, we are now ready to start the dissection. The heart, in its complex glory, is now ready to be explored. Let's embark on this exciting journey of discovery, starting with the initial incision. Carefully, we slice open the heart to reveal its inner architecture. Our first stop is the chambers, 4 in total, each playing a crucial role in the blood circulation process. The 2 upper chambers, called atria, receive blood, while the lower chambers, known as ventricles, pump blood out of the heart. Next, we encounter the valves, acting as gatekeepers, regulating the blood flow and ensuring it moves in the right direction. We have 4 of these: the tricuspid, pulmonary, mitral, and aortic valves. Our journey continues to the vessels. The largest of these, the aorta and the pulmonary artery, serve as the main highways for the blood, carrying it from the heart to the rest of the body. The heart's design ensures that oxygen-rich and oxygen-poor blood never mix, maintaining the efficient transport of nutrients and waste. That concludes our dissection, revealing the intricate inner workings of the heart. Having journeyed through the heart, what are the key points to remember? First, we've seen the heart's intricate structures up close, from the robust muscular walls to the delicate valves that control blood flow. This hands-on experience gives us a unique perspective on how the heart functions. Second, we've gained insights into common heart diseases. Understanding the physical structure of the heart can help us comprehend conditions like heart disease and valve disorders. Lastly, this knowledge is vital for prevention and treatment. By understanding the heart's structure and function, we can make informed decisions about our own heart health. With each beat, the heart tells a story. The key is to understand its language. Until next time, keep exploring, keep learning.